Well, you might have noticed an AED at your workplace or your gym or maybe your child's school, but do you know how to use it if someone's life depended on it?
So I recently visited a local church that's committed itself to learning and hopes to inspire others to do the same. It's New Calvary Baptist Church in Detroit, and it works closely with the American Heart Association to teach its members how to perform not only hands-only CPR, but also how to use that AED. It's training and equipment that they are very grateful to have.
If you see EMS coming through that door, do you stop compressions?
New Calvary is holding a drill,
We are starting.
practicing the critical steps if someone suffers a cardiac arrest. But for the members of this church, it's much more than a drill.
He was an usher. He had a heart attack on post.
63-year-old Howard Moore was at the back of the church when he suffered a cardiac arrest. Janet Banks McElrath is the parish nurse and a trustee. She wasn't there that day, but another member jumped in to help.
One of the members did CPR, called 911, and they took him to the hospital. He lived for around 10 days.
At the time, the church didn't have an AED.
If we had had an AED, I think it would have been a different outcome.
In the years since, New Calvary has an AED and routinely trains multiple members in CPR. Earlier this month, they hosted their annual Love Your Heart Health Fair under the leadership of Pastor James Terrell Thomas.
Because of our presence in the community, we have to not only be a help from a spiritual perspective, but a health or physical perspective.
Even the youngest members are learning hands-only CPR.
You want everybody to be able to know if someone should fall or collapse that you can save a life.
Having an AED on the wall, that's the first step. But what's even more important is regular training and practice to make sure it's more likely to be used in the event of an emergency.
They need to know where that AED is so that if something happens, when you say, you, go get the AED, you know where you're going to get the AED.
Are you okay?
The steps to remember. Start hands-only CPR.
Call 911.
Ask a specific person to call 911.
I need an AED.
Send someone to get the AED and assign someone to meet EMS. Monica Morris-Smith is Howard Moore's niece. She's confident they're all better prepared to handle a cardiac arrest.
I want to be able to provide service to save their life.
Janet hopes other houses of worship will follow their lead.
They all should have AED. They all should have training for CPR. Thank God we have it now, where we can get to it. And the training is provided, and I recommend that everyone receives the CPR first aid AED training because it will help you save somebody's life.
And the American Heart Association recently provided additional training for 5 members of that church at no charge. And the church is also a very large place. That AED that I showed you on the wall there is very far away from the sanctuary. So every day when they have church, they bring it from there to the sanctuary. So now the church has also received a grant to get a second AED.
Yeah.
So they have one in a couple different locations.
Unfortunately, it's a hard lesson to learn in some cases. AEDs are now available in many churches, schools, and businesses, including here at Local 4, though it's not enough to just have one hanging on the wall. Like Rhonda said, you need to be able to jump in and use it if there's an emergency.
So we are joined by Damon Gorlak. He is from Detroit East Medical Control Authority, who helps trains not only first responders, but also people like us here at Local 4. Thanks for being with us.
You're very welcome. Yeah, we go out to the community. We try and do a lot of hands-holding CPR training. Currently, right now, we are working with the AHA to go out to the churches to teach them. We have done the community groups out there. We want to get as many people trained in hands-holding CPR as possible.
Dr. Ryan Reese and Dr. Aaron Brennan with us as well. And Dr. Brennan, let me just quickly ask you, this is personal for you. So when we go through this training and people think, well, you're a doctor, this is kind of the credo or whatever, but it also means a little more to you.
Yeah, so I mean, as an emergency physician, I see patients coming into the ER all the time who have suffered a cardiac arrest, and if they've had good CPR in the field, if they've had good AED placement and defibrillation, the chance of getting that person back and getting them neurologically intact back and living the life that they want is so important. And it's been almost 5 years now, but this is an incredibly personal story for me. My husband collapsed and went into cardiac arrest at the gym. And the only reason that I've had another 5 years with my husband, that he's had another 5 years with our girls, is because the trainer at the gym had recently had a CPR class. Wow. And the gym had an AED and a physical therapist who knew where it was and knew how to use it. And they acted quickly, which is what we're hoping that the community will embrace. Have an AED at your church, at your favorite restaurant. Ask them, do they have one? At the gym you go to, because there's absolutely nothing that can do more to save somebody's life than early, high-quality CPR and early defibrillation.
It's a great message for people who think they're too busy to take that class.
Right, and I also think it's important to point out, you are an emergency room physician. You know how to do hands-only CPR. You've done it many times, but you know that your husband's outcome was better for the fact that he was at a gym with an AED than if he was at home without one.
For sure. I mean, the reality of the chance of surviving a cardiac arrest if you're not in a hospital setting, I mean, the odds are stacked against you. And the best thing we can do is get that electricity, that AED on the chest. And, you know, I firmly believe that the thing that saved his life was the AED at the gym. And even if he had been home with me, an emergency physician at home, I don't know that his outcome would have been as good as it is.
Well, we have video here. This is what Rhonda was kind of orchestrating yesterday, our live drill. I'll put it to you, Dr. Reese. What do you think? How did the crew do?
I loved it. I loved how they jumped right into action. They were assigning roles. Someone was calling 911, somebody got the AED, and they immediately got to the patient, checked for responsiveness, realized there was a problem, and started CPR.
And the switch out too was important. I know you guys had mentioned, because you do get tired doing this.
Yeah, I noted that some of the staff folks were getting real sweaty doing the CPR, and they did a nice job switching off with each other, and they were continuing to do really great CPR and limit those interruptions.
Yeah.
So we had our training 2 weeks ago, so it was fresh in the minds, you know, just after 2 weeks. You conduct this training. How frequently do you think that it should happen in workplace and gyms and schools so that people do feel comfortable going and grabbing it?
I would say that the studies have really shown at least once a quarter. You should really be doing this, getting your hands back on the chest to make sure you remember where the hand placements are, getting the rhythm down, and just getting the feel for what everything that needs to transpire. I mean, the last thing you want to do is just do it, like you said, 2 weeks ago, then a year from now something happens. I still feel comfortable people would want to react, but it's better the more often you can get the practice down.
Yeah.
And I should also mention, it was 2 weeks ago, and it was a drill, but our coworkers were still very nervous. You know, they had, you know, the adrenaline rushing, because that's that moment where you want to make sure you're able to use that training. And Dr. Reese, I have to imagine in real life, I mean, it's a lot more nerve-wracking, but it can make all the difference.
Yeah, it can be pretty chaotic, but, you know, you practice it, you go through the drills. It kind of helps with that muscle memory and remembering all those key steps to ensure a good outcome, having a good
I wanted to point one more thing out, because we have seen where, in just some of the news stories that we report, where someone has had a cardiac event, cardiac arrest, the CPR was done, the patient survived, there was an AED and no one grabbed it.
Oh yeah, we just had one like that. That's right.
Yeah, I mean, how often are you seeing those situations where it's like, in the heat of that moment, people don't think of it?
Well, sometimes AED, people don't know where it's at. People also make a very huge mistake. They lock up the AED because they're afraid it's going to get stolen. So sometimes that person who has the key to it is not around when the event happens. And a lot of people feel there's a taboo with AEDs. If they're not trained how to use it, they don't want to try it. They don't realize, like, as soon as you hit that power button, the AED talks you through everything.
Yeah, important.
And you really can't do more damage to someone in cardiac arrest trying to put an AED on.
Yeah.
Well, not doing anything at all.
We didn't have anybody outside. That was the only place we fell down on the job
To meet the ambulance.
To meet the ambulance, which is hugely important. So we'll work on that.
Yes.
For next time.
As far as training, if anybody's watching right now and they want to be able to access your company to come to their offices, what should they do?
They can go to demca.org, and if you go, there's an information section. You can fill it out, and we'd be happy to come out and teach anyone in the Metro Detroit area hands-holding CPR.
All right.
Thank you so much for being with us. We are really grateful that you're doing it, not just for us, but getting that message out there. And like in your case, Dr. Brennan, this is going to save a life. If people put this into motion, it's going to save lives. So
thanks for coming in this morning. We have much more information as well on, if you want to learn hands-only CPR, how to use an AED, you can look at how-to videos right there on the health page of clickondetroit.com as well.